fallopian tubes, you have the growth, you have the ovary, the cervix, and then the vaginal canal. After the vaginal canal, you see the cervix. So that is where the cervical cancer usually takes place. And if not detected on time, it spread to the upper part of the female reproductive organ and kill the person. So these are the stages of cancer. So the very first picture is a good picture because that is a good service. And then when the cancer is starting, it starts as a small lesion. And that lesion is like a sore. It's just the tissues there become, and then it eats gradually as time goes on. If not detected, then the third picture, it becomes like that. And finally, it gets to advanced cancer, where all the signs and symptoms are visible, and then much cannot be done for the person. So the epidemiology of natural history of cervical cancer. So cervical cancer is the second most common cancer in women worldwide. And the very first one is breast cancer. So if breast cancer is the first, then cervical cancer is the second leading cancer deaths in women. Then each year, approximately 570,000 new cases occur. Means that when we look at the statistics all over Ghana, that is the figure. In 2018, the cancer killed 311,000 women. That's in Ghana. So it means that every year we are getting around 3,000 in Ghana. Then cervical cancer disproportionately affects developing countries. So when we are looking at where it is more common, we are looking at developing countries like ours, Ghana. As our country, we don't have much. Looking at our health system, we don't have all that it takes to do a lot of screening, and because of that, the disease is there, but we are not able to see it. So more people are spreading it, and the whole thing is just becoming more. But because we are not putting the measures in place to be able to detect it, it's just spreading like that. So around 85% of all cervical cancer deaths occur among women who live in developing nations, like I said. In Ghana, it is likely the commonest cancer among women. So when you are facing it in Ghana, then we are looking at it as being the most commonest among women. So meaning that cervical cancer gradually is taking over breast cancer in Ghana. Then the current estimate indicates that every year 3,151 women are diagnosed with cervical cancer and 2,119 die from the disease in the country. So that is the statistics. And that is where we got the information. So you can Google and then get it. So cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. Cancer can start almost anywhere in the human body, which is made up of trillions of cells. So when we talk of cancer, it's just a part of the body becoming diseased. And then those cells around it, because they are diseased and it is cancerous, it will be spreading, it will grow uncontrollably to other parts of the body and then kill the person. So that's what we mean by cancer. Then now the main topic, the cervical cancer. So cervical cancer simply means cancer of the cervix. It is a serious disease which can cause death. However, if recognized and treated early, can be easily prevented. It is very deadly, especially when you get to the advanced stage. That is the cancer, what we call the cervical cancer. That is the point at which it kills. So if it is detected early enough, there are a lot of treatments that are available now for women, treated at moderate cost. But when you get to the advanced stage, the treatment is so expensive that most people are not able to afford. And even those who are able to afford, they go through the treatment, stay with us for a while, and then they go. So it's a very serious situation we have at hand. So now, what causes cervical cancer? I want it to be slightly interactive. So what causes, if anyone, the person can tell me what causes cervical cancer? All right, let's go on. So all these years, we know that cervical cancer is caused by human papillomavirus. That's what we know. But it's not just the human papillomavirus. We have two types of the virus. We have the low risk type and then the high risk type. The high risk types, when the person gets infected with it and there is persistence, it means that you get a virus and the virus stays in you for a long period of time. We are talking about 5, 10, 15 to 20 years. Then it lands you in the cancer. So persistent infection with a high risk human papillomavirus is what causes cervical cancer. Then the HPV, that is simply how we call it, human papillomavirus. It causes nearly all cervical cancers, about 99%. So anytime you hear of cervical cancer, it means that it is the high risk type of the HPV that is causing the cervical cancer. And the low risk, they normally cause the vaginal warts. They normally cause that one. Now, HPV can infect both men and women. Yes, but for men, it is not so common. Once a while, we get a case of a man having a penile cancer or scrotal cancer. So when it happens like that, it means that that particular person is just spreading it. Now, a man can carry the HPV, which is the human papillomavirus, and spread it to a lot of women, but not have this. Because this is what we are calling is cervical cancer. And if it is cervical cancer, then we are talking about those who have cervix. And because the women have the cervix, and the virus also have affinity to the cervix, it happens right there. So the men may be carrying it, but it might not affect them in any way. But because the women have the cervix, they develop the cancer when the virus gets into them. So now the stages, we have the cervical-free cancer. Cervical cancer becomes cancer when the abnormal cells spread below the epithelial layer down into the deeper tissues of the cervix in a process called invasion. So the virus gets into you, it gets into the tissues, it eats, the tissue has layers, it eats down there, it settles down for a period of 5, 10, 15 to 20 years. Then it starts eating up the place up to the surface. That's what happens. So it invades the tissues and then starts causing the disease. So stage 1, the cancer remains confined to the cervix and may or may not be seen with the naked eye. So when it starts, there wouldn't be anything visible, no signs and symptoms, no pain, no bleeding, no discharges. You just be there, normal, walking and coming. You wouldn't see anything. That's the first stage. Second stage, the cancer has spread beyond the cervix, down along the vagina, and may most likely belong beyond the vagina. So, the stage 2, it is no more where it started. It is now spreading to the nearby tissues that are in close proximity to the cervix. So that is what is happening. Then stage 3, the cancer has spread into the lower third of the vagina as well as the pelvic walls and the fallopian tubes. So now your cancer has spread up to the fallopian tubes and all the tissues and the surrounding tissues and organs around. Then finally the stage 4, the cancer has spread to nearby organs such as the bladder or the rectum. Now when you get to that stage, you can see that a lot of damages have been caused. And at that stage, most of them don't survive. We lose them. Now at this stage, the cancer has spread to so far away organs. Let's continue. Now we are going to talk about the risk factors of HPV and cervical cancer. So in relation to sex, and then we are going to also talk about other risk factors. So in relation to sex, the first one you have is multiple sexual partners. If you have you are a man and you have multiple sexual partners. You could carry HPV from any of them and give to others. Maybe you are married, you can pick the HPV from a girlfriend and bring it to your wife in the house. And then you can pick from anybody, like as many girlfriends that you have. And then you can also be a woman that is having multiple sexual partners. You can also pick the virus from any man at any point in time. And then you can develop the cancer. And much as you have multiple sexual partners, then we come to sex at any age. So some of our young sisters and brothers, they start sexual intercourse at a very early stage. By 16 years, 15 years, 40, sometimes even 9 years, they have already started sexual intercourse. So such a girl, if she's able to pick, or if she picks the HPV at that very early stage, by the time she's 20 years, 15 years, she has already developed the cancer. So that is it. And then we come to habits. So smoking, those who smoke a lot. Multiparity, those who are giving birth to, some of our mothers, they are giving birth to 10, 15, 11, some 6. They can also have a higher risk of developing the cancer. Then immunocompromised or immunosuppressed people, those with HIV/AIDS infection. Some people too had kidney transplant, heart transplant. Well, after the transplant, the entire immune system goes down. So at that stage, the person can pick the virus. Because one thing about the human papillomavirus is that when it gets into a person, and you have a very strong immune system, the system has a way of clearing it. So that's why the definition we said the persistent infection. So if the virus gets into your system and the system cannot clear it in the shortest possible time, and it lingers for long, that is when it causes the disease. So now we come to mode of transmission. Over the years, when you hear of cervical cancer, we thought it's only sexual transmitted disease, and we are worried. But now it is so clear that it is not only through sexual intercourse that a person can get cervical cancer. So we have grouped this one into sexual means and non-sexual means. So in the sexual means, we have genital to genital, oral genital, manual genital. We have people that sex toys to play with themselves, and out of that, as you share with your friend or colleague or whatever, you can develop or you can pick the virus at any